Hello, I'm Jim Demo with Clark County Close-Up. Thank you for meeting with us.
Thank you for having us here this afternoon.
Sure. So why has heroin become such a problem in Clark County?
Well, heroin is a problem throughout Washington State. I think what's happened is we got a handle on methamphetamine when we got rid of the precursor drugs. Somewhere in the last 10 or 15, 20 years or so, physicians got the message that they weren't prescribing enough opiate narcotic type medications for people with chronic pain, and the number of prescriptions went up significantly for narcotic type medications, and those are related to heroin. And so what's happened is that a lot more people kind of got hooked and got addicted to opiate-like medications, narcotics. Some of them stopped taking them. Heroin is really very inexpensive right now, and once you become addicted to those kinds of medications, heroin is fairly inexpensive and easy to get. So heroin use has gone up significantly. The other problem with that, associated with that, is that heroin deaths due to opiate overdose, including heroin, has now surpassed car accidents as a cause of death in Clark County and in the state of Washington.
Wow. What kind of impact does this have on the law and justice system?
Well, law enforcement has seen an increase anytime, even though heroin is cheaper. It's about 1/3 the price of what it used to be 20, 25 years ago, so that's why it is more readily available. But you still have to pay for it, and it's very addicting. And sometimes once you get hooked, you can't go more than 4 or 6 hours, so you still have to pay for it. So thefts, auto prowls, burglaries, robberies. Talk to almost anybody in jail for those crimes right now, and they'll relate it right back to their drug addiction. And usually it's either heroin or methamphetamine.
Okay. Now, John, you're part of the Regional Drug Task Force. Can you tell us about this agency and work you're doing?
Sure. The Clark-Vancouver Regional Drug Task Force was basically formed in about 1988, and currently it's made up of the Clark County Sheriff's Office, the Vancouver Police, and the Washington State Patrol. And there's several detectives, a few supervisors, and then myself that I oversee the entire operation. And our main mission is to dismantle and disrupt drug organizations, mid-level to upper-level dealers. But we also work with collaboratively with different groups in the community. We give out several some of the monies that we seize can go back into the community for drug rehab, which we've recently done. And also several of our detectives go into the schools and talk about heroin overdose and drug use.
Okay. Now, I understand that the opiate use has been regionally identified as one of the top health priorities that local health jurisdictions and health partners need to address. Can you comment on that?
Yeah, so we're part of a consortium or a collaboration with our neighbors on the other side of the Columbia River, the 3 county health departments there, as well as the hospital systems. It's called the Healthy Columbia Willamette. And along with the health departments and the hospitals have looked at doing a community needs assessment, which they've done. And opiate overdose, opiate addiction has risen to one of the top concerns. So it's not just Clark County, it's the entire region where opiate overdose is a concern. It's a big problem, and our partners have recognized that as well.
Okay, now public health is recommending naloxone for heroin use and those with whom they come in close contact to have available in cases of overdoses. Can you describe how that drug works to reverse the effects of an overdose and how public health distributes?
Yes, and one thing I want to say is that naloxone is just one component of, we need a comprehensive approach to opiate addiction, and including prevention. But one of the way that heroin and opiates, including prescription opiates, kill people is that it depresses their respiration and they stop breathing and die. And a lot of these overdoses are witnessed by friends, family members, sometimes law enforcement folks who are on the scene. Naloxone is a 100% antagonist to opiates, and what I mean by that is it completely blocks the effect of opiates on the brain. So, and it actually, for folks who are not using opiates, it's a safe drug and has no other effects. The only effect it has is to block the effect of heroin and opiates. So, naloxone is a drug that comes in both an injectable form and a nasal inhaler, and people who are witnessing somebody who's overdosing from heroin or other opiates can administer naloxone safely and basically reverse the effect and save people's lives. It is life-saving medication. We've been using it, we've been distributing it in our syringe exchange program, we've been distributing it to IV drug users and their families. And it's been administered, we've had over 150 reversals in the year and a half we've been providing it to people. So it is a life-saving medication.
Wow. Now you mentioned this drug is only a part of it. What else does public health do to help prevent the spread of disease and injury related to IV drug use?
Well, it is a comprehensive approach, and our law enforcement partners are doing a lot as well. The other things that are going on is we have a prescription monitoring program. So physicians who are encountering patients, there's a database of patients who've gotten opiate-like medications. So physicians can query that database when seeing patients and hopefully reduce the number of prescriptions they're writing. There's some medications, both methadone and something called buprenorphine. It's called medication-assisted treatment that can help people who are addicted to opiates and help prevent them from, treat their addiction and keep them from getting into a position where they're going to overdose. So we need a really comprehensive approach to heroin and opiate addiction, which includes those things as well as what our law enforcement partners are doing.
Okay. Let's change gears here. Now that marijuana is legal to use for anyone age 21 and older, what are the public health implications?
Well, we have a number of concerns about that. Number one is, I'll list a few of them. Number one is marijuana has addictive potential, and it can be addictive for 10% of people in general, and in adolescents, we're very concerned about adolescent use. Up to 17% or more adolescents can basically get really dependent on it. One other concern I have about it is that it has effects on the brain. The brain in adolescence actually continues to develop physically until you're 25 years old. And adolescents using marijuana, we have concerns about, and there's some evidence that it has a negative impact on their development of their brain, including their IQ and their cognitive development. So we're very concerned about adolescent use and access. The other concern we have is about marijuana edibles, and they're not regulated at all. You can't predict how much of the drug is going to be in a marijuana edible.
And when we're talking edibles, we're talking like candy,
cakes. So a lot of these things are really attractive to young children, including very young children. Calls to the Poison Center have already been up around that. We're very concerned about young children getting access to this. It can take up to 2 hours when you eat one of these edibles to feel the effect. So you can ingest a lot of it, and this can be deadly in young children. So very concerned about the effect of the public health implication of marijuana edibles.
Because what child wouldn't want candy if it was on the counter and not, how would they know?
Yeah, and there's going to be a lot more of this stuff available, and some of the packaging is really attractive as well.
It looks like regular candy, some of it. And also the active ingredient in marijuana compared to 20, 30 years ago, the THC levels are much higher, 8, 9, 10 times higher than they used to be. So, and again, as the doctor said, there's no controls of how much goes into these, so they don't know how much they're ingesting at the time, even when they smoke it.
Yeah. So John, let's talk about what are the implications with marijuana legalization. What's happening on law enforcement?
Well, first of all, it was legalized at the state level. It's still illegal at the federal level, so make that note there. Some of the issues that have come up with it, the law is somewhat ambiguous in some of the definitions that it gives. For instance, we recently have gotten quite a few complaints of neighbors complaining about people growing marijuana. And when the drug task force or law enforcement goes out there and checks on it, if they have their medical marijuana paper in order, there's not a lot we can do. However, the smell and whether it's in public view, these are all things that are written into the law that cause problems that some people complain about, and there's not a lot we can do. And you walk away and they see a marijuana grow next to their house and they have their kids there, and law enforcement's hands are tied. So that's one of the main issues we're having right now is not everybody voted for it, and it can be, the smell can be very pungent and whatnot, and whether they're smoking it or growing it. So
What about, have you seen an increase locally in citations related to driving under the influence?
Yes, I was just talking with one of our traffic investigators this morning, and the DUI arrests where marijuana is included has gone up since 502 passed. They are noticing, though, that alcohol is still being added with the marijuana. So they haven't had a lot of just marijuana cases like that, but they have seen an increase. Last year, I want to say March or April, there was the first fatality involving 94th and Padden. There was a fatality involving somebody who had been smoking marijuana. That was the first one that I can remember.
Okay. And we talked about edibles. Again, and you talked a little bit why it's important to prevent children from using marijuana. Can you address that?
Yeah, so marijuana can have some really serious adverse unhealthy effects in kids. Besides the fact that it can cause anxiety and even psychosis where you're having delusions and hallucinating. In young children, it can also cause respiratory depression. So it can be, depending on the dose, it can be fatal in young children. So we really want to, I'm very concerned about edibles being available to young children.
And John, you want to add anything?
I'd like to add to comment on what the doctor said about being addictive or not. Every week I speak to recovering addicts, and I actually bring up the subject of marijuana since 502. And every one of them says there's no doubt that it is a gateway drug and that they've had a problem with marijuana, and that's what got them to the harder drugs. So every person I've ever spoken to in recovery has made that comment.
So it's a starting, okay.
Yes.
Now, will any state marijuana taxes be used locally by local health departments for treatment and prevention?
Yeah, so there is some funding from the state around the marijuana tax, as you noted. The state is issuing a RFP to get some of the money out to local communities. So we'll be looking at that with our partners. I mean, we're certainly hopeful that there's going to be some funding available for doing some marijuana prevention work in Clark County. So actually it's going out to the region, so it'll be Clark together with Skamania using that.
Okay. We have a couple minutes left. Any other concerns going on with the latest drug trends?
Well, the other thing I wanted to mention, I didn't mention that earlier, is that we were talking about naloxone, and
yes,
we definitely want to get more naloxone available because it is life-saving. Our law enforcement partners are beginning to administer it as well, and
I
that's
was
great.
wondering that.
So I don't know if you want to.
Well, recently the sheriff's office, I know that the sheriff's office is in the process of purchasing about 40 units so that the patrol deputies can have them in their cars. I know up north in Snohomish County, they've been very successful. In other places in Washington State, they've had come up on the person who's overdosed and applied it, and they've brought them back. So the sheriff's office, at least I know, they are just in the process of purchasing these units.
Right. And I was wondering, maybe with also the fire departments, for example.
Yeah, I mean,
coordination.
my dream is to get as much naloxone out there as possible. I've certainly, EMTs, fire folks, anybody who might be encountering somebody who's having an overdose. It's a safe drug, and it can really save somebody's life. Now, if you administer it, the person still needs to get a medical evaluation and be seen, because naloxone wears off over time, and some of the, depending on what they've been using, they could go into respiratory depression again. So you can save somebody's life by administering it, but then they still need to be evaluated and treated appropriately. And again, naloxone is life-saving, but it needs to be part of a comprehensive approach, including prevention in terms of dealing with opiate addiction.
Okay. Now, if people want more information about drug use in the community, where are some places they can check?
Well, they can certainly check, go to our website, and there's some information on our website in terms of this particular problem.
Okay, and that's clark.wa.gov
Correct.
/public health, and we'll put that on. And I also have the Clark County Sheriff's Office, clark.wa.gov /sheriff. And then another one I found was on the county's alcohol and drug treatment program, and that's clark.wa.gov /alcohol drug.
Yes.
And if we have another minute, I just want to, if we have a minute or two here, I mentioned the syringe exchange program as part of the Harm Reduction Center. And the other thing one of the benefits of that program is we're able to prevent HIV and Hep C transmission by exchanging clean syringes with people who are IV drug users. We also do hepatitis C and HIV screening there, and we also provide immunizations for hepatitis B and hepatitis A. So it's to prevent some of the complications and, from IV drug use. Again, that needs to be part of a comprehensive program of preventing IV drug use and treating it as well.
And I'd like to add a few final comments here. I know another good website is Lifeline Connections. They're a group in Vancouver that's done a lot of good, and,
Yep.
and the sobering unit is a kind of a subsection of them. But I was going to encourage people. A lot of times we get complaints, so to speak, that they don't see anything done in their neighborhood. They have a drug house and they call the police, they call this person. I would encourage them to keep calling and specifically telling us what's happening. And the drug unit does look at these, but we have a priority. We have to take them in priority, and we look at them. But I do want people to feel that they can call the number. They can report them online also. And we look at each one. Every one is viewed, and we do research on them, and then we go from there to see how much enforcement we can take on them.
Okay.
Which reminds me of one last point I want to make around naloxone. So people should be aware of the Good Samaritan law. So if you end up if you're an addict and you see your buddy overdosing and you administer naloxone to your friend or loved one, because of the Good Samaritan law, you can't be prosecuted for possession at that moment when you're giving naloxone injection. So we just want to make sure that people, aware that they can go ahead and administer the naloxone without fear of being prosecuted for doing so.
Okay. Well, thank you both, and thank you for everything that you do. Thank you.
Thanks.